Well, good afternoon, everybody. My name is Sarah Cooney. I'm a scientist and an independent science engagement consultant, and I'm pleased to be hosting one of the live commentary sessions today. I'm here with two very accomplished guests. I've got Dr. Andrea Constantini, who's a regional science engagement manager for Philip Morris, and I've also got Samrat Chowdhury, who's an advocate consumer advocate from India. I wanted to start actually by, Andrea, asking you about your story. I know you're a medical doctor, and I'm really curious to know how you ended up working for a tobacco company.
Well, first of all, many thanks for having me here, Sarah. I'm really happy to be part of this commentary. And well, that's a very common question that I usually receive, because for sure many people says, what is a medical doctor doing working for the tobacco industry? And well, I will let you know a little bit about my background so you understand why I ended up working in Philip Morris International in scientific engagement, and I'm really proud and excited about being part of PMI. I'm a medical doctor specialized in clinical pharmacology, and before joining PMI, I was working for the pharma industry for more than 15 years in different areas: pharmacovigilance, clinical trials, medical affairs. And I was always linked to the respiratory franchise. That means working for asthma and COPD medications. So I was very, very linked to the disease caused by smoking cigarettes, for sure. And one day, I received the offer from PMI to be part of this tobacco harm reduction project and be part of this vision of creating and working towards a smoke-free future. And the very first thing that came to my mind was, what a medical doctor can be doing working for the tobacco industry, or why they are approaching to me. But fortunately, I was very, very curious and quite open-minded, let's say. So I said, okay, I will listen what these guys have to tell me, and I will take a look at the science that they are producing, because they offer me to take a look at the science. And to my huge surprise, when I started to read all the publications that PMI has on the smoke-free products, I got amazed about the robustness and the seriousness of the science. And I say, okay, this project makes total sense. I'm working for COPD medications. I know that most of the smokers, they really struggle trying to quit. And I also had at that moment my two parents being smokers, and both who had already developed disease because of smoking cigarettes. So with this huge doubt that I have in my mind, this huge dilemma that I have in my mind, I've done what every grown-up would have done. And I went back to my mom to ask for her advice. And I told my mom, Mom, you know, I have received this offer. This is the science. It's really robust. The project makes total sense. But it's the tobacco industry. And I'm a medical doctor. What should I do? And at that moment, my mom told me, you know what, Andrea? I'm a smoker. I've been a smoker since I was really, really young, and I always knew that smoking was harmful for my health. Even though I was aware of that, I decided to keep smoking because I enjoy it. If these products would have been available when I was young, maybe today I would not be ill. And at that moment I said, my gosh, that's what I need to do as a medical doctor, because I really want to work towards preventing people to get ill and dying because of smoking cigarettes. And that's the story of how I ended up working for PMI.
Well, it's a fascinating story. It's a fascinating story. And Samrat, how did you get involved in tobacco harm reduction?
It's a story which is a little similar to Andrea's. So I started smoking young, by picking up dad's butts. And then I lost my dad to smoking in 2008. And I tried a lot to quit. I tried, medications, NRTs, local remedies, none of which really worked. I mean, they worked for a while, and then I was back to smoking. And then one day I found vaping. I could successfully quit. And I thought, okay, my dad should have really had that option. And that's when the ban started coming in India. And then we decided to organize as a consumer group. Then we joined hands with consumer groups from across the world. And that's how I got into consumer advocacy. Now, we would just like, there are 1.1 billion users of tobacco, and we would like all of them to have access to something which is less harmful.
Absolutely. And so, Andrea, do you want to tell us a bit about, Philip Morris has really made remarkable strides in the transformation, industry transformation. Do you want to tell us a bit about that?
Yes, for sure. Well, I'm really proud of that, and that's the reason why I decided to join PMI. Because, well, PMI is totally committed to working towards this smoke-free future, right? And we are putting all the efforts on developing the smoke-free portfolio and substantiating with science that these alternatives, compared to keep smoking cigarettes, represents a better scenario for those who otherwise would keep smoking. And, well, we're investing a lot on that. We have invested so far more than $12 million. And nowadays, approximately 39% of our net revenues are coming from the smoke-free business. Yeah. So that's something that reinforces the true commitment of the company to become a smoke-free company.
Certainly. And Samrat, what are you, I mean, this is your chance to speak to industry, and what are you...
See, we buy industry products, right? Yeah. So we do have a financial relationship with them in the sense that, you know, we are the consumers. We as consumers would like the industry to transition more rapidly because there is a lot of innovation there. You know, everything is moving quite fast, but I think the industry is not or can be a little quicker in transforming. And I understand that it's a multi-billion-dollar industry, so there are a lot of challenges, but there are also lives being lost. So, for us as consumers, we see the urgency because there are lives at stake. So, I'm not saying there aren't challenges, and when big conglomerations change, it takes time for that to happen. But, it's time that it did happen.
I totally agree with you, and as a PMI employee, I would also be able to see that this transformation as a whole, not only industry transformation, but the transformation of the world would be moving more rapidly. Why? Because we know the burden that tobacco smoking represents for public health. And we are all working towards having tobacco smoke not to be anymore one of the main risk factors to develop smoking-related diseases, right? But in order to do so, what do we need? We need to work all together.
Sure.
We need to work the industry with the transformation and the investment to develop new, innovative, and better products for those who otherwise would keep smoking. We need the society to support and to be informed and to demand their right to have access to those alternatives. But at the same time, we need the governments to be working toward this and to be implementing tobacco harm reduction policies and to develop regulations for these new categories of products that nowadays exist and was not available 20, 30 years ago. Yeah. So we need all to evolve at the same pace.
Yeah. I mean, it's astonishing, really, the whole industry, the whole sector is in the middle of this massive technologically led transformation. You're both from low and middle income countries. I mean, I'm curious about what you see as the key barriers to harm reduction in your regions.
Well, unfortunately, in most of low and middle income countries, these alternatives, these no-combustible alternatives, which are better compared to keep smoking cigarettes, in most of them are banned, and they are not legally available for consumers who, for sure, will benefit from having access to regulated and legal products. One of the key barriers that I see is the lack of information. Lack of information, misinformation, both for regulators and the scientific community and the society as a whole. In most of these countries, and Samar, correct me if I'm wrong, but these products are banned based on a precautionary principle, which was one of the discussions early today in the morning, right?
Yes.
And that might have been something reasonable 10, 15 years ago, 20 years ago. But nowadays, we have plenty of robust scientific evidence, both coming from the industry that is developing these products, but also independent evidence, independent research that substantiates that these are better alternatives for those who keep smoking, right?
So why do you think governments are, because the precautionary principle, I mean, why are governments unable to look at the evidence? Why aren't they unable to carry out risk assessments?
Most of the time because of lack of resources,
right.
I think. And, well, as we were discussing, lack of knowledge.
Yeah.
You are from the UK.
Yeah.
The UK is a country that is a flagship regarding tobacco harm reduction policies.
Yes.
At a certain point. And unfortunately, I think that most of the time is that, especially in low and middle income countries, dogmas are prevailing over science. But we're working towards socializing the science. At the end of the day, that's my job, right? I'm part of PMI in order to engage both with the scientific community, with the policymakers, in order to make available the science, allow them to analyze by themselves the science. And at the end of the day, what we are seeking is that they have their own opinion on the science and on the products, but we want that opinion to be an informed decision, right?
Yeah, absolutely. And Samrat, what do you see? What's your perspective?
So I think, the value of human life is a little lower in LMICs than it is in the West. It's a sad reality. So even though there are a huge number of deaths, they're not taken that seriously. I think that's problem number one. And there's also that tobacco and the industry is looked, the whole issue is being seen more from financial terms than from a human and human rights perspective. So, and then if you add on to that nicotine illiteracy, because there's so much misinformation from doctors and surveys show so much. So all this comes together, and then when policymakers don't know about the risk reduction potential of these products, and then there is WHO, which is pushing in a lot more disinformation, I would say, and then it all comes together into bans, and they think they're I'm not doubting the intent, but they think they're doing the right thing. They're trying to protect the kids, but someone needs to go tell them, no, you're actually causing more harm, because not that your ban is going to be effective anyway, because there's going to be a black market. There are going to be fewer consumer protections. The black market doesn't care who it's selling to, so you have, the kids will have greater access than in a regulated market. And also you're not, the government is not getting any revenue. So you're also increasing criminality. So actually making the situation worse. What could have been a tool to save lives could end up becoming a problem down the road.
Yes.
Well, and in the UK, where you described it as a beacon, right? A beacon of hope. Well, it's all changing because
nowadays,
flavors and disposables are likely to be are under threat, and it's really astonishing to watch what's happening in the UK and to watch the way the politicians are just being swept along by almost populist views and refusing to do what refusing to talk to the industry now, and refusing to do sensible things like introduce a licensing scheme so that you would have responsible retailers being the only ones who could sell vapes. So I don't know, it's very difficult and hard to know how things are going to go forward. But I do hope that science will win out in the end, and good science, always in the long run, good science stands the test of peer review. And that's what we have to hope for. But how have you found the conference? What have you enjoyed the last few days?
This is one of my favorite conferences, to be precise and to be honest, because this is the only one that brings the different parties all together. We have the consumer voice, we have regulation, but we also have the industry being part. And I think that that's something key. If we really want to change the world where we live, we all have to have a voice in this discussion. You cannot keep industry apart from this huge change. Industry has to transform, has to evolve in order to overcome what tobacco means for public health nowadays.
Well, and industry is going to make the products that consumers are going to use,
right.
and industry knows how to understands consumers. So, yeah.
But I would like to make a point there. I think the industry has a lot of information on consumer behavior, and I think it could share some more information and be a little more transparent on that front, which would help people like us, who are advocating for these products to be more confident with data, because there is not much research happening. We cannot get, institutional research is not happening on how consumer behavior is transforming. Industry does have that data, and we wish it would share more of it, which should empower people like us to advocate more confidently for these products.
Well, from PMI side, for example, we are totally committed to transparency, and every research that is being conducted is published wherever we can, wherever we are allowed to do so, right? And well, that was one of the discussions that we have had, and I really enjoyed that session that you were moderating, right?
Yeah.
On the fact that many times the industry is being censored and cannot publish, or the manuscript of the research conducted by the industry is not allowed to be published in peer-reviewed journals. It's just rejected because of the funding of the research. And as we were discussing, science is science, and it has to be judged by the methodology and the robustness, not because of the financial source, right?
Well, and I mean, journals should be able to, I mean, there's plenty of good practice about how you disclose funding, how you disclose perceived conflicts of interest. And actually, the actual number of journals with an explicit ban on the tobacco industry is much smaller than people realize. But these journals have very high profiles, and they make a lot of noise about their bans. So, you know, I think there's maybe more we can do to try and find new journals, emerging journals that are owned by good publishers, where they would be more receptive to, you know, high quality research like this. I mean, it is such high quality research. And I was listening to somebody talking about an analysis of academic research versus industry research about these products. And the industry research was actually higher quality, carried out to a higher standard, which I think people are surprised to hear about. But of course, when you have to submit to a regulator, you have to, all of this data is going to be evaluated by a regulator. You have to do things very properly, very carefully.
Sure, and I find this COI thing, you know, for example, there are a lot of Bloomberg philanthropies funded research where they just say that, okay, you know, they funded us, but it had no impact on our work. But that same doesn't apply to anyone else, you know. I mean, it's just that they can get away with just that disclaimer and it works. Why should it, you know, because they have taken positions.
Yeah.
So if that is not COI, then why is this? You know, why you're not evaluating research on its merit? And that will help everyone. And you know, if someone is making those products, I think they have a legitimate right to research and publish research on it, which everyone else does in all across the world, you know, over different industries. So why not the tobacco industry?
And also the society has the right to know about these products, be informed, and make their own informed decision, their own informed choice for the benefit of their health.
Yeah, honest information. And I mean, journals really should be, and publishers should be taught about the conflicts on the other side, which
on the other side as well, right?
Yeah, and they fly, you know, and then
bad.
there's a lot of pushback that we have had to, you know, because they've been attacking individuals, right? Which I think is against some research principle that you shouldn't do that. And, you know, so there's a lot of gross violations happening on the other side, which go unnoticed. And we are sometimes at the receiving end of it.
Yeah, it is. Well, I mean, I've been mentioned in a newspaper article last year for the first time, and I was quite shocked and taken aback by this. And it was completely unfair, but there was very little I could do about it. Just hope that it was tomorrow's fish and chips paper rather than... But yeah. So what are you planning to watch tomorrow? Have you looked at the schedule for tomorrow? We've got... sorry. Have you looked at what you're going to... Actually, there's a panel tomorrow morning rating the evidence, the good and bad science. So that very much relates to what we're talking about
That's
here.
right. And I'm planning to attend that one.
Right, excellent.
Sounds really, really exciting.
For me, it's always good to you know, see what's happening in other countries across the world, so get like a really global picture, because you know, people from across the world talking about their country situations, what's happening in terms of science. You know, your session today on you know, on research was really good, and I found it really informative. So yeah, it's an eye opener. You're updated on science. You also know what's happening across the world. Also, you meet people. You know, and the sense of community that you get by coming here is tremendous. So I you know, I've always appreciated coming here. And
yeah, it's a very nice event. So you'll be going to the Latin America session?
Yeah, with my yeah, the you know, earphones on, with the translation on.
Yeah. There's also a session this afternoon about regulatory risk, investment, and tobacco harm reduction. So that I think is going to be interesting to see about.
Definitely.
Can that speed up transformation?
Regulation is key in order to speed up this switch and in order to make combustible cigarettes at least finally obsolete, right?
Yeah, absolutely. And another option for people this afternoon is the film festival.
Yes, I will definitely be going to that, at least a couple of films that I'd really love to watch from there. There's also one from India. And it also, what I like about that film is it directly addresses the issue of teen vaping in an Indian context. So that could be interesting to watch. It's a short film. All of these are, but I think, so the film festival is one I'm looking forward to.
So youth vaping is also a problem in India.
It is, because see, when, before the ban came in, the vendors were self-regulating, right? So they were, because they wanted to expand. And, if you have 27 million people using tobacco, you don't need kids as a market, right?
No.
So, you have huge enough market to, but after the ban, the market obviously was handed over to the smugglers, people who were smuggling cigarettes and other kind of stuff, a lot of criminality. And for them, now they were bringing in, high nicotine disposables, which are cheap, and it's a one-time contract between the buyer and the seller, right? Not like the mods or pods. So, and they don't care who they're selling to.
No.
So kids or teens now have easier access to these products, and these are high nicotine products, and this is how they're entering nicotine. And because you've banned it, you're not even, and you think your problem is over, so you're not even talking about it, but you're talking about it in very scary, misinformation, disinformation kind of ways. But everyone has access to internet, so they can find out that you're lying. Once you've broken that trust, then they're not trusting you with anything else that you're trying to say. So yes, there is a teen vaping issue, and it can, it couldn't, we shouldn't have gotten here, but yes, we are.
Unfortunately, that's the common consequence that we see all over the world whenever there is a ban, right? The lack and the loss of control of the situation of what is happening, to whom they are being sold, quality of the products, standards that products comply with. Whenever I'm speaking, especially in those markets where there is a ban on the non-combustible alternatives, I always tell that the ban is the worst scenario, is the one that makes you lose the control on what is happening. And I think that India is a clear example based on what you have just said.
Yeah. And, we don't know what's in these products. And because they're smuggled, it takes a long time for them to land in the hands of the end of user. So if it's 1.5-year-old product, what conditions it's been through, there's nicotine in it, it's just disaster waiting to happen. Also, from a consumer's perspective, consumers now have no protection because they're buying something which is already illegal.
Well, and I mean, it's this, although, the vaping products have been legal in the UK for a long time, it's the youth problem has arisen from exactly the same sorts of thing: illicit products that are non-compliant, that are flooding the market, and irresponsible retailers that are selling them. But the UK government doesn't really want to talk about a licensing scheme for retailers, and that would solve so many problems all at once. The trading standards don't have enough.
And from what I gather, the UKVIA, they want this licensing.
Absolutely.
Like it's the vendors who are saying we want to be licensed.
Absolutely.
That's just crazy.
Because it's the responsible manufacturers and the responsible retailers that recognize that their business is under threat from irresponsible players.
I think that the day we all understand as a society, as humanity, right, that the best way to protect population is with regulations rather than with prohibitions. Everything is going to be totally different.
Prohibition never works.
No.
It never
and
works.
this makes things worse, right? These could have been really life-saving. When you have so much death and disease because of tobacco or harmful use of tobacco and smoking, you've turned a tool which could have addressed that problem into a problem, right? Like now, like Clive was saying, it can become ungovernable, if you take a situation down that road.
But, well, I would like to go back to one point that we were already discussing. Nowadays, with all the science, robust science, that is available on all these different products, on all the different categories of smoke-free products, I still cannot believe that it is not seen, is not listened, and is not being implemented, right?
I know. It is really shocking.
Yes.
It is really shocking. Well, I think we're actually coming to the end of our session. So I wanted to thank Andrea and Samrat for joining me in this live commentary.
Thanks to you, Sarah.
And I will hand back to the producers for the afternoon sessions.